Hello, my name is Nicole Katz, and I will be presenting my culminating project on intersectoral action for a whole school health approach in British Columbia. And that will be done through stakeholder engagement and mapping. So I'd just like to give my acknowledgements as I am very fortunate and grateful to be able to live and work as an invited settler on the traditional and ancestral and unceded territory that is covered by Treaty 13 of many nations, including the Mississauga of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people. I'm also very grateful for my practical placements with the Health Promoting Schools team at the BC Ministry of Health underneath the supervision of Heather Wallman and support of Cassandra Sullivan and Stephen Smith. I'd also like to thank all the stakeholders that were engaged, and these include the ministry partners, health authorities, provincial health services, and the government partnered agencies. And finally, as well, I'd love to thank the support of Dr. Jeff. Okay, just to get into my practical project with the Health Promoting Schools team, they work with the health, education, other sector partners to support the initiatives that optimize the health and well-being of school-age children. However, often services for school-age children does cross the jurisdiction of more than one ministry or ministry-funded service. So this does make a complex landscape to fully comprehend. To begin to address and uncover this complex landscape, my role with the practicum included performing an environmental scan to identify and learn about stakeholders responsible for health-related school initiatives at the BC provincial level. Next, the identified stakeholders were engaged to learn about the responsibilities and roles in these initiatives. And finally, with all the information collected, a stakeholder mapping was created, and when shared with participants, there will be a better understanding of stakeholders' current work, priorities, and organizational structure, therefore enhancing coordination and able to address the gaps in communication and service delivery, and finally, creating opportunities for enhanced and new partnerships. So just about the health promoting schools approach is also known as the comprehensive school health framework that supports the improvement in students' educational outcomes while also addressing school health in a planned, integrated, and holistic way through these four pillars: social and physical environments, teaching and learning, policy, partnerships, and services. This approach provides a shift from the individual behavior-oriented and disease-based approach to a population health and socio-ecological approach that emphasizes the interactions between organizations and individuals. So traditionally, public services are delivered in these vertical structures or interactions where stakeholders have a direct connection from their leadership to the members of the public that action it and it serves through a hub and spoke model. The hub is a management center where all information flows through and decisions are made, and the spokes are the implementing group that perform a specific role and contribute to the success of initiatives identified by the hub. Therefore, for the Ministry of Education, their hub, they set the education and policy and standards, which the district school boards or the spokes deliver on. And while for the Ministry of Health, its hub provides the leadership and policy direction for the delivery of health services by health authorities, the spokes. From this traditional approach, there has been increased recognition by governments and other levels of the need to strengthen these horizontal connections that include partners from two or more groups to work towards shared outcomes. And we can see this. In 2005, the BC Premier launched an Act Now BC, a coordinated and integrated government platform for better health for BC. This strategy aimed to develop partnerships outside the healthcare sector with other ministries and agencies and groups from other levels. This intersectoral collaboration recognizes that members and sectors of governments can work together at different levels at different levels, shifting our focus on these horizontal connections and partnerships. This shift towards a whole of government approach aims to break silos, guiding integrated government responses to issues and to work across portfolio boundaries to achieve a shared goal. We need a new model of governance for school health that is focused on partnerships through a whole school health approach that advances the capacity of stakeholders and improves the social cohesion and coherence between partners. So as we can see, the systems are complex. So an organizational map of this environment would be difficult to create clearly. Instead, a chart was used to create and integrate the stakeholder engagements into an organized and clear reading and sharing format. In the far left, we see that stakeholders were identified by their divisions and teams, such as the Health Promoting Schools team and the Injury Prevention Healthy Settings team. They then reported on priority health issues, their roles in the health-related school initiatives, such as service delivery or policy guidance. We then inquired about their guiding frameworks and legislations, and finally about their responsibilities in the initiatives, which were then categorized into leading initiatives, supporting initiatives, and key initiatives. So as seen with the hub and spoke model, many of these initiatives cannot be effectively actioned without the efforts of partnerships. As we strengthen these vertical partnerships, we must recognize how interrelated we are and health issues are, and seek to address these by advancing the whole school health approach. Therefore, I have sought to address the impact of the stakeholder engagement and mapping in relation to strengthening horizontal connections and partnerships that can better address the rising social, economic, and environmental challenges for school-age children BC. And this will be done through the leading initiatives, which connect to the shared priorities, the supporting and advising initiatives that connect to the partnerships and participatory approaches, and finally, the key initiatives, which ultimately bring us to create a sustainable and resilient system. So I'll break those down more now as the shared priorities connect to the leading initiatives. These seek to strengthen the horizontal partnerships and that stakeholders leading initiatives must match current government priorities, frameworks, service plans, mandates, and agendas. And partners both must agree to commit for a commitment to shared authority and responsibility surrounding these priorities. An example for this is done through the interministerial protocols. These are a guided, coordinated effort for the delivery of effective services to school-age children. In them, the Ministry of Health and Education have collaborated on healthy eating initiatives in schools, such as the guidelines for the sale of food and beverages in schools. Next, stakeholders that prioritize the same frameworks can influence and enhance effective intersectoral action, such as the Comprehensive School Health Framework, which is the foundation of the BC Healthy Schools approach. And finally, the First Nations Population Health and Wellness Agenda brings together Indigenous and Western ways of knowing. This strategy was developed in collaboration with the First Nations Health Authority and the Provincial Health Officer, advancing the need for intersectoral action to address the factors that influence well-being for Indigenous people. Next are the supporting and advising initiatives that connect to the partnerships and participatory approaches. These include working groups, community of practice, committees, which facilitate the capacity building and knowledge transfer, while also fostering a strong sense of partnerships across each level and sector. Then we have the provincial level interministerial leadership committees, which address health disparities based on sex and gender and geography. And they also develop strategies to share best practices and initiatives. Also, there's public health professionals, such as health promotion specialists or advisors in the local community that may be key partners to provide crucial technical support. These also include environmental health officers, tobacco enforcement officers, and school dietitians. Some districts even have health promoting school coordinators. These are key for implementing the health promotion strategies in schools. For example, when the capacity and staff is limited, they can assist with grant applications. And finally is building that resilient and sustainable system through these key initiatives. And that these are seen sometimes through committees or coalitions, which play an advisory role in intersectoral initiatives. For example, steering committees were created to address novel pandemic challenges. They work by integrating partners across government silos and include resources from all sectors and levels. They advance a system that is resilient to snapbacks. So these new horizontal partnerships need to be maintained or even leveraged to address the inevitable health challenges arising from the pandemic and climate emergencies. And also at the government level, there is a gap in knowledge of the local level circumstances. Therefore, including groups such as McCreary Youth Advisory and Action Council and the parental advisory councils are key to ensuring important perspective and voices are integrated into initiatives and provides also a foundation of evidence-based practice. And now we'll just get into the recommendations and implications for public health. As clarifying stakeholders' priorities, roles, responsibilities through the stakeholder mapping project is able to advance the whole school health approach that guides the development of a shared vision, help manage consensus, identifies opportunities and priorities, and builds support across sectors. So I do recommend to integrate intersectoral policymaking across all sectors with shared outcomes. As we address rising challenges, we must strengthen the horizontal and vertical partnerships and have collective and integrated conversations around shared priorities and goals, and concurrently seek to advance evidence-informed practice through shared knowledge. And this connects to the integrated governance for health and all policies to better address population health, as the health and all policies requires public health professionals to invest time to build vertical and horizontal partnerships and engage meaningfully with the sectors and levels, and ensure that work is responsive and accountable to community needs. Next is as well, I recommend that in connection to that, we need to identify system leadership that can enhance a robust intersectoral partnerships through building capacity and promoting a cohesive process. Leaders can use their relationships, visibility, and organizational power to identify the support of key players. And this would ultimately advance upstream and health promotion strategies and better address the social determinants of health. And then finally, also recommend to promote participatory approaches and partnerships with local level groups while creating reciprocal relationships with individuals also performing similar projects and mapping, as the sustainability of our school depends on the ability of the system to engage in a whole school health approach that addresses and includes all key persons affected by initiatives. The spokes mentioned before need to be directly involved to build their capacity and capability to ensure effective delivery, not merely—
Nicole, we're
Yeah.
at time. Can you
Okay.
wrap up, please?
Yeah.
No, wrap it up for us.
Okay, almost done. So spokes, they shouldn't be just given mandates or guidelines, legislations. They should really be involved. And this can really bring us to that strength-based holistic approach to health equity, ensuring that no one is left behind while also advancing that system resiliency. Yeah, and thank you. That is all for my presentation. I'd like to thank all my colleagues as well. For all the support. I really appreciate it. It's been great. And as well, I just have some recommended webinars if anybody would like to listen on, as I've learned a lot about intersectoral collaboration and governance, and a lot of these have been very interesting, including one that's coming up, the health and all policies on May 12th. So,
okay, well, we'll leave, please leave that slide up, and anybody who is interested can take a quick screenshot and then you go to the recommended webinars.